Advanced practice providers, or APPs, play an integral role in team care, an important element required to transform your practice to meet the requirements of the oncology care model and other alternative payment models.
When you're trying to perform in the oncology care model, you have to have a team approach to care delivery. And the APPs are instrumental in the continuum of care in seeing patients for scheduled visits, in seeing patients with new symptoms or problems, in chemotherapy teaching, in education, and in advanced care planning. And these are all very important aspects of the more comprehensive care, the high value care we want to deliver to patients, and the APPs will be in the thick of things.
We have APPs within our practice pilot site, and they are kind of shared resource for our physicians. One of them is more focused on survivorship already, and one is trained in advanced care planning and work closely with our social worker. So those kind of skill sets lend themselves well to this team-based care and kind of developing relationships with patients at specific times along their care continuum.
Advanced practice providers can be utilized in many important roles, including seeing patients for follow-up visits, which allows the physician's schedule to remain open for new patient visits, conducting chemotherapy teaching sessions, advanced care planning, symptoms management, and potentially manage patients after hours or on weekends.
There's a lot of things nurse practitioners can do. So they can start with doing one-on-one chemo teach. We found in our ED reduction project that one of the biggest factors of reducing people going to the emergency room was they had an appointment with the nurse practitioner for an hour-long chemo teach one-on-one.
APPs play a crucial role in helping patients with team care. They provide an alternative to the physician for visits. For example, when patients call in with side effects of chemotherapy that need to be addressed, the APP most of the time has more flexibility in their schedule to get those patients in and get them taken care of, rather than the patient having to go to the emergency room for care, which is vastly more expensive and not as appropriate for the patient. The other important piece that APPs bring is just a different way of dealing with the patients. For example, in our advanced care planning role, I find that our APPs actually do that very well. And when a physician tries to talk to patients about end-of-life decisions, the patients tend to wrap that up with their cancer care as well. But when they talk to an APP who's not directly responsible for their cancer care, they're able to be much more open and honest with them about their needs and values.
Successful integration of advanced practice providers takes planning, clearly defined roles and responsibilities, and frequent communication.
From the oncology care model perspective, we're going to recommend that the advanced practice providers begin that team care approach by even participating with the team huddles that are going to go on during practices during the weeks on the OCM. And we think that the advanced practice provider being able to interact well with the layers of staff in the office, certainly contributing to patient care, managing patient symptoms, possibly providing care after hours or on call.
In our Minnesota Oncology, we have 11 sites, and we have some sites that are fabulous in using nurse practitioners. And we have some sites that really don't, and the nurse practitioner only sees patients when the physician's on vacation, or will have a bunch of add-ons that day of people they've never met before. And that doesn't create a work environment that makes them want to stay. And so they don't get job satisfaction, they're going to move on. So use the nurse practitioners and find how they can best be part of the team.
Integrating advanced practice providers and creating a team care environment takes planning, time, and leadership support.